So I'm Dr. Dean Blumberg, and I'm Professor and Chief of Pediatric Infectious Diseases at UC Davis Children's Hospital.
Well, Dr. Blumberg, thank you for joining us. We're talking about whooping cough, and I think a lot of us think of this as something from the past. Is it making a real comeback?
Yeah, so whooping cough has always been with us. Vaccination has made a real good dent in it and really decreased the number of cases that we see, but it still occurs and it's cyclical. So it does go through peaks and valleys. We get a peak every 3 to 5 years or so. And now we're seeing one of the bigger peaks in recent years.
What does it actually sound like when someone has whooping cough, and why is it so dangerous?
So what happens is when people have whooping cough, especially young children with smaller airways, they cough, 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 cough without being able to take a breath in. And then at the end of that, they have kind of this violent inhalation where as they inhale the air, it goes into their small airways and you hear that whoop of the whooping cough. And it's especially dangerous in the young infants. For those less than a year of age, that's where we see the majority of the deaths due to pertussis in this country.
So, what is it that's going on right now that we're seeing such a spike in cases around the country and here in the state of California? Is it that we're seeing more cases or just more severe cases?
We're certainly seeing more cases in California. A part of this is probably related to a hangover from COVID, from all the lockdowns, which really affected transmission of a lot of community-associated diseases. And then we had a buildup of susceptible people. In addition to that, there's been increasing vaccine hesitancy, and even a slight drop in the vaccination rate can lead to comebacks for these vaccine preventable diseases. So we're running at about twice the rate of pertussis cases this year compared to last year. And last year was about 4 times higher than the previous year. So we're really hopefully reaching a peak this year and we need to get through this and then hopefully it'll decrease next year as more people become more immune.
There was a campus warning at UC Davis as well, so this raises a question I think in a lot of people's minds. Are college students at risk as well?
Yeah, college students are at risk because generally the last time that they're going to have been vaccinated for whooping cough would be at 11 to 12 years of age. And then the vaccine-induced immunity only lasts about 3 to 5 years. So it wears off and then they're susceptible again. So certainly high school students, as well as college students and young adults can be susceptible to getting a whooping cough, even if they've been vaccinated in the past. The good news is it's less severe even if the vaccine-induced immunity is worn off so that you get breakthrough infection. The breakthrough infection is less severe than if you haven't been vaccinated at all.
And Dr. Blumberg, you mentioned waning immunity. So if I, for instance, got vaccinated years ago, could that protection be falling away?
Yeah, it certainly can be falling away. The most protection you get is in the first year following immunization, and then it gradually decreases thereafter. So people who've been vaccinated 5, 10 years ago probably don't have that much immunity against whooping cough.
This comes, though, at a time when I think there's a lot of vaccine fatigue in the country, and many people may be feeling, well, I've got enough shots. I'll take my chances. What would you say to patients like that?
I think for those who are most vulnerable to getting severe complications from pertussis, they really should be vaccinated. So that's really the target that I would focus on. And so certainly anybody who's around young children, infants, it's good to protect them by having the people around them vaccinated and immune. Certainly during pregnancy, we know that vaccination during pregnancy decreases the risk to the infant by about 90%. So during pregnancy, we do recommend getting a vaccine during every pregnancy because it can be so severe in infants. And certainly for infants, we do want to get them vaccinated, and the vaccine schedule is actually front-loaded to protect them at the time that they are most vulnerable to severe disease and even death.
And we are seeing a rise in cases, again, around the country and here in the state of California, but does this in any way rise to the level of, say, a COVID outbreak or a particularly severe flu influenza year?
Yeah, I don't think this is rising to the level of a COVID outbreak. You know, with COVID, we saw about 1 million deaths in the US from COVID. And with pertussis during a bad year, we might see like 20 deaths in infants. So it doesn't rise to that level, but it can be very concerning. Obviously, every case is tragic that dies. And for those even who don't die, it can be very disruptive to their life. And when you see an infant who's coughing with pertussis, it's just horrible to see what they're going through. And no parent wants their child to go through that.
And could you let us in, tell us what it's like to treat a child or a young person with whooping cough? What is that image?
Yeah, so once we make that diagnosis, we do give antibiotics, but by the time we give the antibiotics, in almost all cases, it's too late to really help that patient. So it really doesn't help them get better, but it does decrease the spread of the infection. So at that point, we're really giving supportive care and making sure that they can get enough air to breathe, enough oxygen. For the youngest infants with severe disease, they may keep coughing until they stop breathing. So they may need to be in the hospital, in the ICU, and monitored, sometimes on a respirator. And then sometimes we just have to support them when they're coughing, hold them, pat their back, and make sure that they're getting enough fluids because when you do have such a severe cough, it can also induce throwing up. And so we want to make sure that kids' nutrition doesn't suffer during that time also. And for older children and adults, it can be quite disruptive, causing them to miss school. The cough can be so violent that it can cause ribs to break, and that can be quite painful for older children and for adults.
Well, Dr. Blumberg, thank you so much for your time. I want to leave you with the last word. If you have a message or if there's just one thing that you might want to say to all of our viewers or people across Northern California, what might that be as it pertains to this rising, I don't know if you call it an outbreak, but this rising cases of whooping cough?
Yeah, I think it's important for people to know that for those who are most vulnerable to severe disease, those who are around infants or have infants, that they're the ones really we want to make sure that they're up to date with their vaccinations, that they're protected, that they don't then increase the risk of transmission to those young infants, and make sure your young infants are up to date with their routine vaccines.
All right, thank you so much. Appreciate your time.